Welcome everyone. Naomi Kaduwela here, head of Kavi Labs at Kavi Global, passionate about all things data, healthcare innovation, and the future of digital health. And today I'm really excited to introduce our guest. He's someone who's pushing the envelope in healthcare revenue cycle management with a lot of automation and agentic AI and really exciting topics that we're going to cover today. Not only this, he's also a well-known podcaster and an industry thought leader. So here today we have Evan Martin. He is currently the Vice President of Revenue Cycle Management at ZoomCare, and he has over 17 years of experience from his hands-on hospital operations to consulting. So we are really excited to hear from him and how he shaped all these different strategies for major organizations. He's now leading the tech-enabled transformation at ZoomCare, and you might have heard of his podcast, the Wilshire IT RevCast, a brilliant podcast series where they dive very deep into the intersection of healthcare and operations and technology and revenue cycle management innovations. So without further ado, Evan, welcome. Thanks for being here. And please take a moment to introduce yourself in your own words and maybe share with us what excites you most about the work you're doing right now.
Yeah, thanks for having me. I'm super excited not to be the host for a change. So I I have been in healthcare my whole career, actually, my whole life, really. I can remember when my mom was a floor nurse at a nursing home and then a chief nurse sitting underneath tables and building forts. So healthcare has been in my blood my whole life. I love what I'm doing with my team at ZoomCare. I've been there for about 6 months now, and really diving in to help them maximize our EEHR platform that we use, really continuing to explore business partners and how we can leverage technology to advance us as a group. So, and better support them. So it's all about building my team and how I can build that team up. And then thanks for plugging my podcast. Yeah, we're on season 4 actually right now of the Wilshire IT RevCast, and it's a fun passion project after leaving the consulting world where I started it. I asked it and they asked if I wanted to stay on and still host and produce, and it's kind of my little side gig that I get to do for fun and get that creative outlet, but and also learn more about organizations and figure out what's really industry happening in the industry right now. So thanks for having me.
Fantastic. Our honor. And yes, it'll be great to hear from you as a guest, as we've all been so honored to see you host so many lovely podcasts. So, Evan, without further ado, let's dive in maybe a bit more on your role and some of your current initiatives. So, as the VP of Revenue Cycle Management, share a bit more. What is your mandate? What areas are you focused on today? And what does a day in the life really look like for you?
Well, that's a lot. I think from being a VP of revenue cycle in a practice management group versus a major health system adds uniqueness to it. So not only am I over the traditional revenue cycle functions, front end all the way through back end and bad debt collections, I'm also over managed care contracting and then our credentialing services for our provider and provider enrollment. So there is this whole aspect of, wearing multiple tentacles and branches in a practice management group. So I really have, while I don't believe in silos, I have to fundamentally have file drawers for each of them so I can flow easily and then remember when I have to pop them out because they all have to talk to each other. Um, my team is amazing, and really our led initiatives as a group, it really comes from when I first started, I it was a privilege and a sadness that the director of revenue cycle had stepped down and was leaving the organization. And that meant I really needed to pull the leadership team underneath of them together to help me figure out what was their vision, what were the goals and objectives they were having. So this year it's really about technology, as you put in my wonderful intro bio. We're spending a lot of time right now partnering with our with our clinical teams and with our IS and our EHR optimization team on really focusing in on what's going to add a value add to the patient experience, but what's also going to add a value add to our provider experience. So is that, ambient AI? That's currently in a pilot stage right now. We're also looking at bringing in Gen AI for coding automation. I have a small lean mean team and 200 plus providers. And when you factor in a small team to help code and audit for 200 providers, you really do. We're seeing the need with backlogs of being able to bring in technology to support us versus bringing in additional labor. I want to do it. I want to really enhance our team this year. I keep telling my leadership team is our goal is to train our team to be expert auditors and expert analysts that can go in and see what the technology is doing and then help correct it so that we can better improve it to give them the harder work to do and let the technology take care of the things that are kind of the time suckers of statusing a claim, doing things of that nature. Adding a modifier when we know the payer always requires that specific modifier because of the uniqueness of that. So really that's where we're focusing in on this year and day of the life. Right now, I'm a roll up sleeves kind of person. So while I'm still looking at it from a strategic perspective, and we're marching towards cash is king and getting our AR down and in alignment, it's also really about for me. I don't want to ask my team to do something that I'm not able to do. So I've been rolling up my sleeves and learning how to use our EHR and how to do some of the claim processing and billing so that when we are backlogged, I can jump in after hours as well and help out when I'm not in meetings or having fun times recording podcasts. So
Wow, fantastic, Evan. I love what you're saying about rolling up your sleeves and getting in there, being able to do the tasks yourself. I think that also gives you a great understanding to the pain points that the team might be having or the opportunities of where are the sticky points, where could integration be improved, where do you need more data insight. So actually by going through it, you can really connect and sympathize and empathize and innovate with your team. So I love that. And I also love what you mentioned about targeting each persona, right? So from the patient to the provider experience to the internal employees, all these different use cases, how can the AI, the agents, the automation help each of them? So maybe that's a nice segue. We'll kick it off starting from the patient perspective and then maybe work backwards. But yeah, I would love to hear, Evan, beyond the financial performance and operational efficiency, which of course we're going to talk about. How are some of these innovations in revenue cycle management, the automation, the AI, the digital workflows changing the end patient experience? What can they expect maybe in terms of impact, like access and billing and their overall satisfaction? Feel free to share your thoughts.
yeah, I think from a patient experience perspective, it folds into multi layers and multifaceted in the sense of that if we step back and just look at a non-healthcare consumer experience today, most of us are accustomed to using apps to self-schedule or elect to go someplace. We're also used to not speaking to people and having an auto dialer call you to pay your bill or a bill reminder where you can push a button. So while we have had that in the healthcare industry space for a long time, we haven't recognized that as AI and technology. And now that we're watching these organizations develop AI agents really that are having full conversational components. It's funny. I got some Meta sunglasses and I think of it from a patient experience perspective, and that even is I was sitting there waiting for my daughter to finish a doctor's appointment and I flipped my sunglasses on backwards over my head so I could hear it wasn't having to wear them right on my face in a waiting room, but I'm listening to my book on tape and I'm getting and instantaneously I got a reminder about my doctor appointment the next day and it gave me that verbal reminder. That's that component of being able to take that and say, okay, let's leverage that for the patient communication. We're also facing with, the generations who we don't want that full interaction when we're paying bills. I just want to be able to call and interact where I need to interact or interact with that agent. So really having that experience be tailored to the individual patient and not where it just has to pick up a bias, press one for Spanish or two for this language. The agents actually can pick that up and grab that and convert over based off the person saying hello and then it responding like they're talking to a human, and it knows to switch to that dialect or whatever language they need to do. So I think that's really where we're going to see transformation with patient from the patient experience on that side. The other things that I think we can now also do that better support the patients, and we're going to start to see it, is where we're traditionally doing a financial clearance and screening where it's a financial counselor doing that. We can have agents go out and pull credit reports and do soft pulls and things of that nature to determine if a patient actually meets some of those financial components for us. That then kicks it to a counselor to be able to have a conversation with somebody about, like, hey, you do qualify for Medicaid. I know you might not want to hear that, but let's get you in the process so that that's something that doesn't become your expense that you're also having to manage. And then last but not least, I'm super excited about it. We're looking at it for ZoomCare right now, is having our EHR acts automatically self-enroll a patient without them even knowing into a payment plan if their balance is over a certain dollar threshold, so that we are automatically setting it up as a convenience for them. We've notified them in our financial consent, like, hey, you could be automatic if your balance is over X, you'll be automatically enrolled into a payment plan based off of our payment plan terms. You can opt out of that just by calling or going and paying the full balance. But for those patients who have to actively seek out or wait for a collections team or our self-pay collections team to call to set them up on a payment plan, this will automatically enroll it based off of what's the dollar threshold, our terms and conditions that we naturally would be providing the individual anyways. So
Really cool examples that we're seeing of agents and how they're transforming it. And I think integrating it into our daily experience, just like you were saying, the notifications that come on your phone and, through your AirPods. And I can't wait to play with the sunglasses. Let's talk now about some of the challenges or maybe opportunities that we can call them. So in the revenue cycle space, there's a lot of different complexities, denials, prior authorizations, challenges with payers. So, what are some of the biggest challenges in terms of what you and your team are seeing right now? And how are you tackling some of those challenges?
yeah, I mean, we definitely are challenged. What my team constantly is being challenged with is a lot around denials and like where should we be putting our time and effort in that denial proportion and component of like how many times do we win this? How many times do we lose this? So we are starting to look at business partners that can do the denial predictive analytics for us and really go in and say, hey, if you get these denial codes, the IRC and CARC codes, and they pair up for this payer, you based off your history of writing these off, you don't win them X percentage of the time. Don't put your effort there. Put your effort into these ones. And that's really where we've seen a huge opportunity to really point our people to their specialties and give them that passion so that they're getting those wins. The other thing is low dollar balance write-offs, right? There are some EHR systems out there that require you to review it all, but if you can get an agent in there or a bot even in there that can just go and say it's $25, it's past X number of months, you've not collected on it, write it off to low dollar balance, non-recoverable, it's way easier and it takes out the time of the person, and then setting it up so it doesn't stop to require somebody to approve it. Just for those simple transactions, let the systems do that through the automation portion. That's some of what we're configuring right now. When we went live on our EHR almost a year, well, it's been a full year now, the team wanted to get their fingers touching everything to make sure it was working. And now we're in that place of, okay, let's automate what we can automate. But I even have been to, in my consulting days, I would go into an old, a client that's been on their EHR for 10 years and they're not using the self automation that's built in. So I always tell my team first, like, hey, this is our problem. Prior auth right now, we're more of an on demand program. So we're doing a lot of retro prior auth. We know that up front. So let's flag certain types of services that we know when the patient puts that as their chief complaint when they're scheduling their appointment, it automatically triggers it over to our prior auth team to know that they need to go pull that record information and submit an urgent auth same day so that we're not having to wait the 72 hours and then request a retro authorization type of deal. So there's just little things like that that I think that we are definitely struggling with and figuring out how do we leverage our EHR first and then how do we pull in other technology and business partners to supplement that for us, because that's where I think we definitely had a little bit of the struggle buses. When's the right pull? When's the right push portion of that?
Got it. Got it. Yeah. Thanks, Evan, for sharing some of your challenges, echoing some of the others in their comments around denials and prior auths. And love how you're putting automation and predictive analytics to solve those things. So, definitely denials, predictive analytics is a huge opportunity, right? You want the team to be working on the most high value claim that's most likely to be paid in the shortest amount of time so that you can improve the revenue, get it faster. So a lot of opportunities with the predictive analytics to prioritize the work for the team, at least the work that's not touchless. It might be ideally touchless in the best case if it can go all the way through with some guidance. But as we know, there's some last mile work still with the human in the loop. So in those cases, it's great to see how we can enable them. Well, looking ahead then, Evan, would love to hear your vision for the next year or so in RCM. Where do you see, maybe your specific organization or organizations in general in the industry need to go, and how can they assess themselves that, okay, we've gotten there, we've succeeded? How do we measure that success?
Yeah, I think the first thing as an organization, we have to step back and measure, are we ready? What's our readiness level for AI, for automation, for going beyond RPA? Because most of us use RPA, have used RPA for years and years and years. But what is that what's your comfortableness? And then what is the and are you actually is your platforms actually ready to receive that? So there's the organization level of risk and feeling, okay, we're not ever going to be 100% comfortable, and where are we willing to start to play and take that risk? And then what is that frequency going to look like for the continuation of the path? I also believe I'm a huge believer in competition. So if you can, and I think as organizations, we have to get out of the mindset of just not going with one business partner. And I think we've witnessed that through, you know, data breaches, systems going down, automation vendors going out of completely going up and belly under and having to sell off parts of their stuff in the last 4 years. We've all experienced these things in the revenue cycle, which has made people a little more hesitant and gun shy. And then you have thought leaders and people who are out there like, I'm just going to do it and take the risk. And I'm kind of one of those. I like to take the risk, but I also am the person that's like, let's compete. So if you're going to go and do coding automation, there's nothing to say like you can't split your clinics in half or your hospital and health systems in half and go half of it with one vendor and half of it with vendor B so that you could toggle back and forth or even see what's the percentage of accuracy and what does that look like. Yes, it's a lot more work to stand up to. I get that, but sometimes it also gives you that opportunity to say, you know what, they're really great in podiatry and women's health, and they're really great in primary care and inpatient care. So we're going to target those based off their specialties and not have them cover the full house yet until their data and elements get there. So I do think that we have to be a little more strategic, and I think we're going to start to see that just as a lot of us are looking at dual clearing houses. Um, we've for many years for low dollar balance, outsourced business partners. We've always had people competing. Same with bad debt vendors. We've had them competing. I think we're going to get that in that same space with technology now, and that risk level of realizing we can't always build our own agents. We're going to have to pay people to maintain those agents for us as well, versus let's get our own IT department. It's too expensive to have it where you're constantly having to be in the thought process of what's next that it needs to be doing for you.
Yeah, thanks for sharing your thoughts there, Evan, on this innovation, but also how to diversify, mitigate the risk, and do some rapid prototyping, real prototyping of many solutions before going ahead. Because sometimes you don't really know until you get into the details, till you build some of it out. So yes, I hear you, it can be a little bit more costly, but I think for the long term, that type of strategy investing in multiple R&D fronts makes absolute sense. Are there any other big bets or innovations that you're making right now, or anything else you want to share in this area?
I would say I'm not doing it, but one area that I do think that is super innovative out there, and I won't say who they are, but they're out there. So you can read. I'll get you my contact info. Anybody who wants to get in contact with me, you can hit me up on LinkedIn. But and I'll tell you who they are. But there is a business partner out there doing a payer scorecard across multiple organizations that's available to see by multiple organizations. So they're actually scoring out in some states the every major health system in that state has bulked into doing it, and they're leveraging that data. I think it's now that you have that data, how is that going to then integrate? I'm putting on my managed care contracting side of the hat. How do we take that data and have that automate some of the language that we need to populate into our managed care contractors contracts for our managed care contracting individuals, and doing some of the modeling based off of what those scorecards are out there. I think it is our way of health plans can see all of our data as what they're paying all of us as health systems or medical practice groups, but we can't see what they're paying everybody. So this scorecard gives us that even level keel of what that looks like. And I just think that will be the next round of like, now how does that automate into our platforms or integrate into our systems so that it's live conversation and live analytics to be able to target where we need to be.
Wow, powerful solution. Everyone definitely follow up with Evan to get that link. So we've talked a bit about it already, but there's so much hype indeed around agents and automation and a lot of the solutions running on cloud. What technologies are you most bullish on? Have you found some that are actually delivering the tangible ROI and more than the coolness factor beyond the
Yeah.
demo?
Yeah, I first and foremost, generative AI coding, it's blowing it out of the park, especially in the ED spaces and a specialty services where providers really need it. I also think what I'm really excited to see is when an ambient AI group gets together with a generative AI. So the ambient AI agent AI is giving the provider recommendations, and they're taking their historicals and doing all of that. But then it throws in that Gen AI coder at the real time. And I think where that will be super awesome to watch and successful will be in surgical groups and ASCs, where they're doing the procedure and they're talking through the procedure real time, and those two together could be coding it out and trigger, oh, you're not authorized for this anymore, kick that over to the rev cycle auth team to go get a retro auth, because as we're coding this case real time, it's telling us that you need something else. That I think we will
Wow.
be there in a couple years, and I'm super excited to see it based off those two technologies so quickly coming into the space and so quickly advancing. I think once we get them together and then we can get that front end connection in our EHRs, I think it will give health systems a leg up on the quickness of what's needing and be less reactive, still reactive, but not as delayed reaction. It'll be more real-time reactions.
Wow, that will really be something to look forward to. And how do you feel the pulse of the industry is on that topic? Are all the parties open to that?
I think they're all playing with it now. I really do. I think like you're watching. I don't think anybody's fully merged. I think everybody's still doing suggestive coding through ambient AI, which I'm all for as well. But I think we're getting there, and I think we're pretty close. All the parties are there. It's just which party's going to pull the trigger first and be the ones that are like, okay, we're going to be the risk takers, right? I think that's where we're at right now.
Oh my gosh, exciting times then on the cusp of seeing that emerging breakthrough. So we'll stay tuned on that. We'll check back with you next time on how that's going. So can you walk us through now maybe a recent initiative that you're running, perhaps on the automation and agent side, and share some of the real world outcomes as well as the lessons learned?
Yeah, I would say we at ZoomCare we haven't done a pilot yet other than ambient AI, which has actually been going really well. It's helping that pajama time, as the industry calls it, reduce for our providers quite a bit. So far things are showing positive in that regards. The biggest lesson learned, I think, with any solution is it can't be decided in a silo. So even like an ambient AI agent, a lot of times it's being driven by the clinical departments to pick it, but it has a downstream effect for revenue cycle and the governance around clinical documentation and the requirements there and what needs to be present. So it's important for all of us as rev cycle leaders, IS leaders, clinical leaders to step back and say these need to be organizational decisions with each party that is affected at the table. Um, and I think that's been my biggest lesson learned, even at ZoomCare as we're evaluating our which AI agents we're going to be looking at bringing in for which sources, or even bringing in generative AI. We're currently talking with several potential business partners to come in and support us in that space. It's really come down to, okay, we've done our first pass, like, yep, this makes sense. Now we've done it with IS, but really for me, it's about when do I get the clinician at the table for their buy-in and their portion, because let's face reality. I mean, if they're documenting X and our coders or the system say Y, their RVUs are going to be modified, which means usually their reimbursement is going to be modified as a provider as well. So having a provider champion and having a rev cycle champion and an IS champion, I think is really key for all of us when we're making these decisions, and your patient experience champion as well. Whether that's patient experience reports up through rev cycle or clinical ops or in general, back end or marketing, wherever it is. I think having somebody there at the table to keep you constant, like how's this going to affect our patients or look to our patients? Those are the four pillars that really need to be part of these decision-making processes. That's what I've learned. Whether it's for even prior auth, like what does that mean for a patient if it doesn't get auth by the agent correctly? So
Yeah, no, thanks, Evan. I think sometimes in these upcoming automation and agentic solutions, the lesson learns are really the valuable ones for others to take. So thanks for sharing on that. In Can you share any other advice for the healthcare leaders who are modernizing their healthcare revenue cycle? What advice can you give them with regards to balancing the human and machine? Basically, which aspects should we delegate to the machine, and where do we need to make sure that human maintains some controllers in the loop?
yeah, I would say automatically anything that's easy and is a time sucker, like posting cat payments, things of that nature, have it be automated. Like that's totally fine. And then have the rules that kick it out. Um, to be prepared for that, we have to first prep our staff to become the auditors. And I said that a little bit earlier, where their job is to really audit the automation and be checking in on that and figuring out what went wrong, because it's no different than a human doing it. We have more errors with humans touching it than we do with the automation, but we as humans program that automation, so we've automatically put in some form of a human error. So it's funny, I was talking with a colleague recently about this as they're looking at coding, and they're like, well, I really want the, like, if my coders are at 90% accuracy, I need that, I'm bringing this in so that we're at 96%. And I said, yes, but I totally agree with you. However, you only can accept 90% accuracy right now, and you're allowing that. That's all you can expect your for that solution you're bringing in, because it's learning off of your team. So if your team's only 90% accurate, it's only going to be 90% accurate initially until it gets fed more information, and your team, through auditing their own stuff, corrects it, and then it recorrects the system, and you tell that platform. So I think that's really the element, that it's about getting your team prepared to not be the person doing it, but being the one who's monitoring it and modifying it and teaching it to be modified. And remove the easy, like, even some of the hard stuff. If you really think about it, it's not hard. It's complex. So figure out what are those complex controls that it can do for you, and then what can be executed. I've been looking at something. It tells me about, give you guys an example of that, is having an agent go out and pull all the clinical record for a prior auth. I don't necessarily want the agent to just pull it and then submit it. I want it to pull it, my prior auth team review it, hit the green light, and then that another agent comes in and grabs it and goes load it to the payer's portal for us. So my person's doing the auditing versus taking the time to have to pull all the elements. If something's missing, they'll pull that element in, and then the agent is looking to say, oh, I missed that. Now I know in the future, because every time they're having to pull this portion in, I need to now start to pull that in, and it gets updated, and it learns that based off what the end results were. So that's where I really think, like, if you look at it, the person's still there and there's still the prior auth specialist, but they are now auditing the everything got fed to them, and then the easy work of just getting it loaded is taken away so that they can then get to that next one.
I love how you mentioned this evolution of the role and how they have become auditors now. And I think you're touching on a key thing in the future of work and how it's really redefining every role and moving them from human in the loop to this human on the loop, more of, as you mentioned, monitoring the automation and being that reviewer, doing that check, giving feedback so that the system can continuously learn and improve beyond, the original human data with some bias in the training benchmark set. Um, Fantastic. So, what is one skill or mindset that you feel is most critical given the kind of, change management that we're driving in this space right now?
I think, ooh, skill or mindset. I would say the mindset as a leader, you have to be willing to be that risk taker yourself to get your team willing to take the risk. You don't always have to be the early adopter, but you have to be willing to take the risk to allow your early adopter to push you in that direction. Where I think we get stagnant as leaders, myself included at time, is I've overanalyzed what I want to make, where I'm thinking I'm making the best decision, versus if I just made a decision, I probably would still have ended up with the same outcome. So I think we should apply that logic to our evaluation process with, where do we want to start and where do we want to go? If you found a problem and there's a business partner out there with the solution, see if there's more than one, evaluate three, and then just take the leap and try it out. And a lot of the cool part about the AI space is it's an no risk agreement where they're going in and they're letting you do a trial for a duration of time. And then if you say, yeah, I want to stay, then they do a small retro look back for a lesser portion of the what you maybe would have paid initially. So I do think we can be creative with our business partners, but we got to be willing to take the risk and or willing to relinquish control so the team members who are willing to be risky are ready to go ahead and run with it. So
Absolutely. Thanks, Evan. Good words of advice. So any other final parting thoughts or comments, words of wisdom, or topics that we should cover before we wrap up today, Evan?
and my words of wisdom are go out. If you don't listen to a ton of podcasts, there are a ton of business partners, there are a ton of revenue cycle healthcare tech organizations that are talking about this every day. I didn't even know what an AI agent was until somebody came on my podcast and talked to me about it. So, and then I got super excited, and then I ran down a rabbit trail of learning about it. I think the more you're willing to expose yourself and learning about what's to come and not what's here currently, you're going to be able to be an earlier adopter or start mindsetting of, okay, what do I need to start doing with my team to modify them now? Because let's face it, change management on systems is easy. Change management with people is the hard part. So, we planning to bring in, generative AI. We started the conversation 6 months ago with my coding team. We didn't start it, 3 weeks before while we're in the process of starting to evaluate the vendors. We started it before we started the evaluation to get them ready. And what does that mean for them? And learn from them too. What are their fears so that we can figure out, are they going to be factual or are they not going to be factual as we go through it? So I think that was what I would recommend is get out there, learn as much as you can, and share that with your team so that you're getting ahead of the fear factor game.
Forward-looking perspective to get the team successful on the change management. So thanks, Evan. Thanks for that. So without further ado, Evan, would you like to just let people know how they can reach out to you if they would like to follow up regarding your podcast, other resources, or just if they want to connect with you for any other opportunities?
Yeah, I'm super active on LinkedIn, posting between the Wilshire IT RevCast and also ZoomCare stuff and HFMA. I'm currently the president for the Oregon chapter this year, so really big on social media. Feel free to reach out to me on any of those venues. You can also email me at just emartin@zoomcare.com. I'm always happy to connect with people, learn. I would say, and then yeah, I love my podcast. Absolutely, it's kind of like I said, it's my passion project, baby. It started off with Daniel Binkini and I pitching it in an internal Shark Tank competition, and that's how it came about. But it's taught me to keep my eyes open and learn about all aspects of it. And we don't just cover IT portion of it. We do talk about the new proposed rules that are coming up and bringing in experts about reimbursement. We also talk a lot about the human aspect of HR management, and I bring on a ton of HR leaders and recruiters to talk through how to do things differently in today's day and age and recruit towards the different generations and how you're going to have to target each of us um, way different. I mean, let's face it, you have baby boomers who aren't huge into tech, and you have kids that are coming out and they've had a iPad in their hand since before they were born, basically. So, yeah, so it's just a fun way, but feel free to reach out to me in any of the mediums. And if I don't get back to you right away, just hit me up again. I tend to get a little distracted on things sometimes.
Lovely. Well, thanks again, Evan. That is a wrap for today's deep dive. As always, it's such a privilege to bring these important conversations on innovation and technology and the future of healthcare forward. So thanks, Evan, for your help today in doing that, sharing your wisdom for all others. And if you're looking to elevate your revenue cycle management with automation, AI, predictive analytics, or looking for expert outsourcing solutions in US, India, or Philippines, feel free to reach out to me. You can reach me at contact@kaviglobal.com. Looking forward to hearing from you, and thanks, and until next time.